So at this point in the pandemic, how concerned should we be as more people are vaccinated? Here to help answer that question is Dr. Perry Wilson. Dr. Wilson, good morning. Thank you so much for joining us. So if you're exposed in today's day, do you still need to quarantine and alert everyone that you've come in contact with like we were doing?
Well, it's a great question because a lot of us are getting exposed right now because case rates are very high. We are in the midst of really what it amounts to a second Omicron surge right now. But CDC guidelines say if you are fully vaccinated and you're exposed to someone with COVID, no, you don't have to quarantine for that. They recommend wearing a well-fitting mask when you're in public and getting tested 5 days after your exposure. If you were not vaccinated or not fully vaccinated and you were exposed, then the recommendation is to quarantine at this point in time.
And if you do get COVID, how can some of the antiviral treatments help you out?
Well, some of the antiviral treatments are incredibly effective. Paxlovid, for example, showed an 85% reduction in hospitalization and death rate among people who had COVID that were prescribed the drug compared to people who got a placebo. So that's a big reduction. One catch, you got to take it early in the course of your disease, so within the first 5 days of symptoms, and not everyone is eligible, but way more people are eligible than may think they are eligible. The best way to figure out if you're eligible, talk to your doctor. So as soon as you get that positive test, doesn't matter if you're young or old or what you think your comorbidities are, go ahead, call your doctor and ask if Paxlovid is right for you. I sound like a commercial, but that is the right thing to do right now.
Well, we keep hearing about people like Jimmy Kimmel getting COVID twice. Is it still rare to get it a second time, especially so close?
No, it is not rare. We're seeing reinfection more and more. This happened a lot during the initial Omicron wave. Omicron seems to avoid past immune defenses, whether that comes from prior infection or even from vaccination to some extent. And we're seeing it again in what's really amounting to become a second Omicron wave. Fortunately, most of these reinfections are relatively mild, so people are sick and obviously they can't go into work when they have them. But most people getting reinfections are not getting hospitalized or having worse outcomes. So there's some reassurance there.
All right, Dr. Perry Wilson, thank you so much for your time today.